It's great to physically be at a conference and actually meet people. I'm sure it's been a very long time for many of you as well. And for those who are joining us online, a very warm welcome, and hopefully we'll get to see you in the not too distant future as well. Now, we've assembled quite a formidable expert panel to walk through some of the hot topics related to the prevention and treatment of COVID-19 today. We have one of them here in person, and we've got three expert panelists online joining us as well. If we just slip through to the next slide, please. Dr. Nakorn Premsri is the director of the National Vaccines Institute in Thailand. Dr. Nan-Chang Chiu is the chair of the Vaccine Injury Compensation Program within the Center of Disease Control in Taiwan, and he's also the chair of the Pediatric Disease Society of Taiwan. Dr. Erlina Burhan is a pulmonary specialist in the Faculty of Medicine at the University of Indonesia in Jakarta. And Dr. Barnaby joining me on stage here, is an infectious disease consultant at the National Center for Infectious Diseases right here in Singapore. The next slide has our standard, if we just work through these quickly, Cheryl, please. Just go to the disclaimer slide. Okay, these are our standard disclaimers. I just want to mention, given that this is an AstraZeneca sponsored symposium, we are very proud of the contribution that AstraZeneca has made towards helping to manage COVID globally. To date, we have provided more than 1.7 billion doses of our vaccine at no profit to the company since launch. And that has made an enormous contribution, enormous difference to the lives of many millions of people around the world. Now, just a note to manage people's expectations around today's presentation, this panel discussion is not intended to discuss specific AstraZeneca products. Most of the COVID prevention and treatment options available, the products available, most of them have emergency use authorization only, and many actually not licensed in a lot of the countries dialing in today. So we may talk about specific examples to illustrate certain points or concepts, but the objective here is really to discuss some of the broader issues that the people are talking about in this space. Okay, so let's get to it. If we go to the next slide, we've got a broad list of the main discussion topics. We've only got about 40 minutes to do this. I want to make sure that there is enough time for questions from the audience and from those online at the end. So we obviously won't cover all of these topics, but we'll kind of work through them in whatever order that we end up doing. Okay, so to get the ball rolling, I suggest that we start with the COVID programs section, and we'll talk a little bit about what has been happening in this space. So this is just a snapshot of the rough progress of vaccination programs within quite a few countries within this region. Now, this is about 2 weeks old, this data, but shows you the general trend, and you can see quite clearly that there's quite a different gradation of how countries are doing. I've got a couple of specific examples, I guess, that I could walk through with each panelists, because we've got some country examples that will be more interesting, I think, to work through. But I think you can see, just from this slide here, that some countries in this region, clearly are doing very well. Some, still getting up to speed, I think, with their programs, and there's multiple reasons for that across the different countries. So I think rather than focusing on, who's doing really well and who's not doing so well, I think let's look at a couple of examples relevant for each of the panelists that can kind of inform, what was happening locally throughout this pandemic. So if we go to the first example from Thailand. So again, this data is just from a global website, so they're all tracked independently, but just demonstrates, just to orient you on the graph, the green curve is the daily confirmed number of COVID-19 cases per million people over time. And the lighter blue curve is the vaccination coverage. So this is fully vaccinated, 2-dose coverage within Thailand. And then the colored bars you can see at the bottom just illustrate some of the social distancing measures that were put in place either through the school system, through workplaces, or through stay-at-home recommendations, etc. And I guess the graph speaks relatively for itself. Perhaps Dr. Nakorn, if you're if you're happy to discuss a little bit about the situation in Thailand. And I think one of the interesting things of this graph for me is that cases were very, very low through most of 2020, and only a recent peak that we've established this year, but again has been quite well controlled. Dr. Nakorn, any thoughts?
Yes, thank you very much, Dr. Bruce, for taking the example from Thailand. We can see on this graph that the declining trend has been occurred when we reach a good coverage of vaccination, even not just reach like 20%, but we can see the declining trend. And I would say that it's a combination between the vaccine coverage and the lockdown measure. Government decided to put the intensive lockdown measure during the peak of the epidemic in the country, in Thailand. And I would mention on the well cooperation from the people, like on a preventive measure, wearing masks, social distancing, and hand hygiene watching. I think that those still be very important. And together with vaccine coverage, we have a good picture like this, that the declining. However, there still be the cluster occurred in the province, but the situation in the epicenter like Bangkok or periphery are getting better and better in day by day. By the coverage in Bangkok and periphery is reached around 80% of population. For the moment, we are increasing the coverage among the high-risk population, like the elderly and comorbidities, pregnancy, in the province. And I think by the end of this year, we will reach more than 20% overall of complete vaccination of 2 doses, while we are starting the booster dose as well. Over, Dr. Brooks.
Yeah, that's great. I think, you know, one of the differences I think that we're seeing in a lot of these Asian countries compared to Europe and the US, for example, early on in the pandemic, was much greater mask compliance early. I think people in this region have a stronger history, I think, with these kind of things, with the original SARS outbreak, and so a lot more acceptance, I think, of wearing masks. Interesting in Thailand too, I think, you know, you're kind of accelerating the implementation of booster doses. I guess there's been quite a lot of work in the background in Thailand trying to understand the immunogenicity of the different vaccines and how they're lasting over time. So it's quite, I think Thailand's quite at the forefront of that in terms of introducing booster doses as well. Okay, if we go to the next example, this is for Indonesia. And so again, similar orientation, the blue line is the number of confirmed daily cases per million, and the lighter kind of orange line is the vaccination coverage for Indonesia as well. So Dr. Erlina, would you like to try and elaborate a little bit on how Indonesia has handled the pandemic so far?
Thank you. Good morning, everyone. Greeting from Jakarta. So the condition in Indonesia is very conducive. I mean, comparing to the situation in a few months ago in July, which was over 50,000 new cases every day. But currently it is getting much better. Since October 15 up until now, we only have like a new confirmed cases under 1,000. This is really good. We achieved the flattening the curve. So this is probably due to the good health protocol that being implemented by government and followed by the community. It was very hard before, but since we got really bad hit by the second wave in July, then their mind mindset changing in the population, which is now is getting better. Not only the good health protocol being implemented, but also the coverage of vaccination is also increasing tremendously. Up until now, we already have 126 million population being having first dose of injection, and then around 80 million of now already having second injection or complete vaccination, and over 1 million of healthcare worker already had third injection. So now the government is planning to have the third injection for the other population, but that is targeting in early next year. So I think we are in the very good track. We are number 68 now in the globally, and 21. Our ranking now is 21 in the Asia. So I'm very optimistic that by next year we will have over 70% of population being having complete the second vaccination, and also I'm very optimistic that we are in the flattening curve for the confirmation case. So the collaboration between the government and the population or the community is the key important thing in a contribution of this good achievement.
Exactly.
I think that's all, Bruce. I hand it off.
Thanks, Dr. Erlina. Yeah, that's great. I think definitely a bit of a slow start, perhaps, but I think the recent developments and the government's been doing a very good job trying to procure enough doses, I think, for the whole population, and those rates will come up quite quickly, I believe, in Indonesia. So that's very good news. If we go to the next one, we have Taiwan. So Taiwan has been a bit of a standout, I think. They had very, very good control for a very long period of time over pretty much all of 2020, and then had relatively a small blip. It looks big on this graph, but in the scheme of things was a relatively minor rise in cases. So I guess, Dr. Chiu, perhaps you can explain why Taiwan did such a great job early on during this pandemic.
Okay, thank you, Bruce. Because 70 years ago, we have a SARS outbreak. And during that year, that lasted for about 4 months and have around 346 patients being involved, and 73 died due to the SARS outbreak. And at that time, actually, it's a crisis for our society. So we have set up a lot of issues to deal with similar cases. So last year, when SARS-CoV-2 became a problem in China, and we expect that maybe we'll have some threaten, and we already do a lot of things to handle that. As mentioned, just like Thailand and Indonesia, face mask, social distance, and hand hygiene, and it's what we have been done. And actually, I think especially the face mask have a very good result, because we have the manufacturer to face mask, and now in Taiwan, almost everyone knows the importance of face masks. So people can accept to use it. And I think it can stop the transmission of droplet infection, spread infection. So we get a very good result. And these things needs the government and the people association to help each other. And our government have a central epidemic command center, and they have to report every day in the noon, and so people can knew the exact condition in Taiwan every day, then the first new information. And so we do not need to be panicked for the situation. And about the vaccination, actually, in the beginning, we also have some problem for getting the vaccines because in the beginning, the vaccine is not easy to get. And we try to make COVID-19 vaccine by ourselves, but it takes time. And until now, the vaccination rate for first dose is around 75%. And the second dose is near 40%. And I think in the coming months, the vaccination rate will become higher and higher. And so I'm also very optimistic because I think the condition is still in well control. However, I think the media is a very important issue because sometimes if the media just focused on not good things, but not what we have achieved, that may cause some problem and that will make unnecessary panic. So that's what I want to mention.
Yeah, it's a very interesting example in Taiwan. I think, quite proactive leadership by the government, good acceptance around the mask compliance and acceptance of vaccination, I think, by the public. But that transparency piece, you mentioned daily press conferences by the CDC to let people know what's going on, and complete transparency of communication, I think was a wonderful example to share. Okay, if we move to Singapore now, Singapore was another one that had relatively good control, I think, through most of 2020. They had some initial challenges when the virus first emerged, obviously, but quite good control through most of 2020 and the early half of 2021. But as you can see from this graph, the red line or the pink line here is the daily cases. So quite a significant spike very recently here in Singapore, despite quite a high vaccination coverage.
Yeah.
Barnaby, can you help us explain that?
Yeah, I mean, that's true. So to look at the overall vaccination uptake, I think across the population, it's about 85% now. But that includes children under the age of 12. Yep. So if we break it down by age group, I think every age group apart from the very old have over 90% uptake, which is great. That does still mean that there are several 100,000 people in Singapore who are unvaccinated. Correct. Despite this. And these unvaccinated people are unfortunately posing an increased burden on the healthcare system as they sort of contribute a outsized proportion of the number of people who are requiring oxygen or requiring HD or ICU care. Our vaccination curve in Singapore is a little bit different when compared against the infection rates, when compared with the other countries, which I think is interesting. The vaccination started here just before New Year's last year. So it started at NCID amongst healthcare workers and sort of slowly ticked along until around about May, June time, when there started to be a large outbreak of Delta in Singapore, which you just see as that initial bump after June the 4th in the graph. And then the government rapidly expanded vaccination access to the general population. And now the large outbreak that we're seeing is in the face of high levels of vaccination. I guess showing to some extent the limits to which vaccination can prevent infection and transmission, exactly. But it's very clearly protecting against severe infection. I think, and that's sort of looking at the Thailand graph in particular, and the Indonesia one, where there was that initial peak from Delta, and then it's coming down as vaccination rates increase. That may be partially that bump from the peak in antibody response post-vaccination. And then in Singapore, we're probably seeing the population immunity is actually declining because vaccinations were given a few months ago. So that initial protection against infection is perhaps declining. But protection against severe infection persists very well.
And that's a very good point. I think people have this presumption that the vaccines are waning and not working as well as they should be, but they're actually working very, very well in terms of preventing severe outcomes, hospitalization and deaths, and that's the primary role of what we're trying to prevent. So just to illustrate that, I guess, let's jump to the next one. I've got a UK example here. So this is age standardized mortality rates in the UK, and just by vaccination status. So the blue line on the left-hand side at the top, you can see, is unvaccinated individuals. The lighter blue line at the bottom is within 21 days of the first dose, and the pink line is 21 days or more after the first dose. And the green line, which you can barely see because it's so low at the bottom, is after the second dose of vaccination. And you can see quite clearly, on the big picture graph on the left, that once you're vaccinated with one dose and preferably with two doses, mortality rates drop off, quite dramatically. There's an expansion on the right-hand side. You can see here, just to illustrate that a bit more. And vaccination after 21 days or more after the first dose is marginally better than unvaccinated. You could argue either way in that case, but the two-dose vaccinated is very clear. The mortality rates are very, very close to zero in the UK. So one of the best demonstrations I think that I've seen that for fully vaccinated individuals, these vaccines are working very, very well at preventing mortality. Okay, let's just conscious of time. If we go back to our index slide, what would you like to talk about next?
Variants.
Sorry?
Variants.
Okay, yeah, variants of concern. All right, that's a hot topic. Everyone's talking about Delta at the moment. So I guess just to reassure people that these vaccines are working across the different variants. Obviously, when the vaccines were developed and rolled out, they were all targeted against the original Wuhan strains or variations of that. And so, there was concern, I guess, that as the new variants came, there would be lower effectiveness because of the mutations changing the way the virus is binding. But this data coming out of the UK demonstrates very, very clearly that for the two vaccines that were primarily in use at the time there, the ASTRAZENECA and the Pfizer vaccine, effectiveness against the Alpha strain and the Delta strain is very good. There's some differences, obviously, but appears to be working quite well. Two-dose effectiveness against the Delta strain for both vaccines is well over 90%. So very, very encouraging, I think, that the vaccines are doing what they're supposed to be doing. For these more severe endpoints. I think we'll come to that waning issue because there's a lot of conversation around vaccines are not preventing infection as well as they should be, but for these severe endpoints, as we're talking about, working very, very well.
I think this helps sort of to illustrate that Delta has emerged sort of in spite of the vaccine and not because of the vaccine. So it's not a hard sort of immune escape variant,
exactly,
which can evade host immunity from vaccination or infection.
Yeah, definitely.
Yeah.
I think there were concerns initially. I think when the beta variant arrived in South Korea, people were concerned that might be a bit of an escape. But as it's turned out, it hasn't spread as broadly as was feared. So that's been less of an issue. But I think the vaccine data that we have demonstrates that they actually work relatively well against beta as well. It's not quite as well, but it's not bad.
Yeah.
I think there might be some of that on the next slide, actually. So if we go one more study. Yeah, this is data out of Canada, which looked at 3 different vaccines across the range of variants that we're seeing there. This was a population study within Ontario, so basically everyone vaccinated there. And again, you can see here, against hospitalizations or deaths, so the more severe outcomes, for all the vaccines, one dose effectiveness is pretty good. It's, high 70, 80%, but 2-dose effectiveness, you're getting close to 100%. So clearly these vaccines, all of these vaccines are working very, very well for what they're designed to do.
Yeah.
Okay, so I guess we'll be talking about the waning issue. Let's jump into that one, I guess, as well. That's been a hot topic because that's what's driving the conversation, I think, around the necessity for third doses. I know, the data from Thailand around waning antibody levels. There's been data from a lot of other places. What you're looking at here is data from Israel, where they looked at breakthrough infection rates effectively compared by the month of vaccination. So for people who are vaccinated in January, for example, in the dark blue columns, right through to vaccinated more recently in May in the very light blue on the right-hand sides of each curve, and split by age groups. Now, it's not a simple compare one to the other type thing, because the way the vaccines were rolled out, they were rolled out for different age groups at different times. So clearly the younger age groups did not receive vaccination before, about March or April in Israel. So, we can't do the same sort of comparison. But I think the trend, here is quite clear. You're seeing a declining infection rate with more recent vaccination by month in Israel. If we go one more slide, they've converted that into vaccine effectiveness, just to make it a bit clearer for you. And just to illustrate this point around vaccination preventing infection as opposed to preventing severe illness, I think this demonstrates that quite well as well. So you can see the curves on the left-hand side, the graphs on the left-hand side, by month again, between January and April in this example, from the blue to the yellow. You can see that, this analysis was done about July. So about 6 months after people were vaccinated in January, their effectiveness against general infection or symptomatic COVID infection has dropped off quite dramatically. I think there's a real concern around the ability of these vaccines to prevent spread of infection. But if you look at the columns on the right-hand side against hospitalizations and severe COVID, many cases of those leading to death, that effectiveness hasn't really changed very much. You could argue there might be a couple of % drop, but they've been very, very strong over that entire period. I'll just show you one more piece, I think, as well, from the US. This demonstrates a very similar process. They're going through this in the US as well. So on the left-hand side, you've got SARS-CoV infection. So again, that effectiveness is dropping off quite substantially from about, high 80%, close to 90%, down to below 50 in the US now. But again, on the right-hand side, against hospitalizations, the curve is actually pretty flat, irrespective of the age group you're looking at. So I think they're very, very good indication of the fact that these vaccines are working really well. I know we don't track mortality rates, probably as well as we should in this part of the world, but certainly in Singapore there are daily figures, and those rates have come right down, I'm sure, as well. In Thailand, Indonesia, and Taiwan, for our panelists, I'm quite sure Taiwan has very good figures for mortality reductions. What about Thailand and Indonesia? Do we know what's going on in that space for vaccinees compared to unvaccinated populations?
Yes, I can take this point. I think we see the same picture as the vaccine can prevent well on hospitalization and severe cases. We have seen this especially among the healthcare workers, that the vaccine can prevent pneumonia and prevent the hospitalization. Even the effectiveness for the infection declining, but we still see the good effects on hospitalization and severe cases. So that we see the same picture. We have a team that are collecting the vaccine effectiveness at the recent data. They are working on this. So then we will see, hopefully, the same picture, the effect of vaccine on severe cases.
That's great.
Yes.
It'd be good to see that effectiveness data. We've got a lot of immunogenicity data coming out of various countries, and Thailand's leading the way in that. But effectiveness, I think, is what we're missing from many countries. We've got some, and we can go to that a bit later. But it'd be nice to see some of that data. Dr. Erlina, in Indonesia, you're also seeing declines in mortality?
Yes, a few months ago, the government already released the data showing that vaccination prevent community from symptom, and also prevent quite a high number can prevent the hospital admission, and also preventing those who already admitted to the hospital, prevent them admitted to the ICU. So I think we have the similar situation here. And there was also a survey in one big hospital showing that those confirmed cases that being hospitalized were 80% were among those who have not yet vaccinated.
Okay.
I think that was the situation in Indonesia, and it's quite similar to this slide.
Yeah, quite a clear contrast. And Dr. Chiu, Taiwan?
Actually, you only have a surgery in middle at the end of the May this year, and that was controlled actually not by the vaccination, but by the isolation, by the screen for the contact person. And because we don't have a mass endemic, so actually, and we have no data about the vaccination effect. But we believe that the similar condition may occur if we do not get the vaccination, outbreak will still comes out. So we still want to increase our vaccination rate and hope that after we have enough vaccination people, we can let the society become more similar to previous society. That means that we can do not need to isolation so easily, and maybe we can open our bar or other things.
Yes, it's been quite a happy problem, I think, for Taiwan. They've had such good control.
That they can make people feel much better.
Yeah, you've had such good control, I think, throughout the pandemic that you're quite fortunate, I guess, that had such few cases and very few COVID-related mortalities, I think, which is a very happy problem for Taiwan. I'll just touch on one more aspect before we go to the next one. If you just go forward one more slide. What we don't know, I guess, is the waning that we're seeing with these vaccines. Is it the same for all vaccines? There is some conflicting data coming out of the UK. There's, depending on the study you read, some of them are suggesting that the rate of waning effectiveness for these vaccines may actually be different. These are still early, I think, in the process. A lot of these vaccines, a lot of these studies are only looking at a couple of months out from the 2-dose schedule. So I think we probably need to wait and see a bit more data to work out what's going on in that space. But I think this is another interesting nuance, I think, when we start to look at how these vaccines are performing globally. Okay, if we go forward one more, I think maybe let's just jump topic a little bit. Let's look at some of the populations that potentially may not be able to be vaccinated very well and may benefit from an alternate approach, if you like. So this is a study out of the US, and it's for mRNA vaccines, but this applies pretty much to all vaccines. What this shows is there are specific segments in the population that do not respond very well to vaccination. I mean, we've known that for quite a while for many vaccines. And ultimately, it comes down to the level of immunosuppression, I guess. So here, it quite clearly demonstrates that, for people who are undergoing organ transplants or under immunosuppressive therapies, you get a less than optimal vaccine response. And I think it's not really a surprise, but it's been quite well documented now, I think, with these COVID vaccines as well. One more slide forward, I'll just show you a study from the UK, which looked at this as well. And they looked at vaccine effectiveness stratifying through the population according to the types of comorbidities they had. And, your definition of immunosuppression, I think, varies quite a lot. It could be heavily immunosuppressed in a clear clinical definition. There's an argument that people with diabetes are, partially immunosuppressed as well. So I think there's a spectrum there, obviously. But this study shows quite clearly that those with well-defined immunocompromised clinical outcomes have, a much lower vaccine response, certainly after 1 dose, minimal vaccine response after 1 dose. But even after 2, it's better, but still quite reduced from other populations. So clearly, I think, there are some segments of the population where vaccination, is still, I think, still worth trying, obviously, but it's not going to be the perfect solution. So for these, clearly, we're going to need to start looking at alternate options. If we could just go to the next slide. The reason why that's so important, I guess, is not only are these, some of these immunocompromised people at higher risk of actually catching COVID, but those that do catch COVID have much worse outcomes. You're likely to see, much more likely progression through to serious outcomes and potentially death. So I think for these groups, clearly we need to look at other options. And one of those, I guess, that's being discussed at the moment is around passive immunization. So, Dr. Young, I know you've worked quite a bit in that space. Maybe you can share a little bit of your experience of what the options might be in that area.
Yeah, so the options for either post-exposure prophylaxis or pre-exposure prophylaxis with a monoclonal antibody to reduce infection. And so there are some monoclonal antibodies which are available, which have a very long half-life, and so can be administered to people before they've had any exposure or any known risk of contracting COVID-19. And they can receive a monoclonal antibody, and that will effectively protect them against developing COVID-19 subsequently. So, I mean, it provides the benefits of vaccination, or at least the antibody benefits of vaccination for people who are otherwise not able to respond so well
Exactly.
to an immune stimulation.
Presumably it provides almost immediate protection, right?
Infuse, and then yes, so you don't need to wait for a second dose or for the 14 days maturation of the immune response subsequently. I mean, so yes, we have monoclonal antibodies to protect the individual, and this is where also vaccinating their household contacts, particularly so everyone else within household, to reduce the chance that they're going to be even exposed to COVID-19 is important.
Exactly. Yeah. So certainly, I mean, I know Singapore is looking at this. In some of the countries, so certainly for Thailand, Indonesia, and Taiwan, presumably, all of these populations in this region will have similar rates of these types of comorbidities and immunocompromised populations. So there's obviously pockets in all of these countries, I think, that could benefit. Is there any work going on in your countries for the other panelists around potentially exploring how best to protect these patients as well?
Yes, Dr. Bruce, we have a study in one of the medical school, and the professor over there study on the organ transplant population, and we see the lower immunological response among them. I mean, among the patient. So this being recommended to have the booster dose. I mean the third dose for those immunocompromised hosts, especially for the organ transplant. So we have one published paper on that as well.
Oh, great.
Yeah. Even not the big number, but it's quite significant, and we see the evidence of a lower immune response.
Yeah, I mean, these are quite niche populations, some of them too. When you get down to, hematological malignancies and things like that, the numbers of patients, I guess, get quite small. But I think, some of the data that we've seen is quite impressive in terms of the unmet need for an appropriate immune response, I think. So, yeah. Dr. Erlina?
Yes, thank you. In Indonesia, the elderly is one target group that my government put a special attention. So there were quite some approach applied to get those elderly vaccinated in a large number. But there was also some situation that this group of some group of elderly cannot be vaccinated. They were not eligible due to the many comorbidity, etc. So we have to make sure that this kind of group that cannot be vaccinated, it should be prevent from the transmission. So we have to make sure that the people around this elderly has already vaccinated. So those can protect this elderly to become confirm to catch the infection, and also there is an effort to tell them to have this mobilization restriction
Mhm.
Yeah, and there are also a target group that having comorbidity, but the Indonesian government is a bit loose in this criteria. So we try to get to cover this people with comorbidity to get vaccination. So we are not that very strict with this comorbid with people with comorbid.
Yeah, that preventing that secondary community infection, I think, is so important as well. So getting the coverage rates up amongst the community, and it's almost a a cocooning type approach. Making sure that people around these vulnerable individuals are vaccinated. It makes a huge difference as well. Dr. Chiu, I'm guessing with relatively low cases in Taiwan, there's probably been less work in this space.
Yeah, and we also urge the high-risk people to receive the vaccination, especially we ask them to receive the second dose. And whether we'll give them the booster dose, that is under discussion. And about the passive immunization, even though we have tried only a few, because we have so little patients number. So we only try a few patients who received the monoclonal antibody, but because the case number is so few, so we can't get a good result still now, and there's no statistical result still now.
Yeah, and it's a fairly rapidly evolving space. I think there's quite a few products in development and a few on the market already. So I think we'll see a lot more going forward for those products. Yeah. Okay, if we go back to the index, what's next? Ladies' choice, Dr. Erlina, what would you like to talk about?
The future.
The future. Everyone wants to know the future. Okay, so I guess I could just paint some broad strokes, and then I think you guys are far more qualified probably to talk about this than I am. But I guess we're still in the early stages of a global pandemic. This is a coronavirus, and so we can probably learn a little bit from history. There's other human coronaviruses that have emerged in the past, probably not as dramatically as this, I have to add, but certainly not as well documented. And so we can probably build in some expectations about what may or may not happen. Part of that is around the evolution of the virus itself. Part of that is around evolution of human immunity as we go forward. But it's quite likely, I think if we look at the left-hand side of this chart, the normal stages of virus evolution through a pandemic is, you start with when it first emerges, the population is naive, having not seen it before. You get quite high infection rates, significant morbidity and mortality. And the interesting thing with coronavirus, we've actually seen a disproportionate number of adults affected. Children were largely unaffected initially. I think that is changing a little bit with some of the new variants, perhaps. Yeah. But that was the situation initially. Then I guess through time, as we get more used to seeing the virus, whether it's through vaccination or natural infection, we start to build up a little bit of individual and community immunity. The infection rates moderate a little bit. They tend to come down a little bit. And certainly the morbidity and mortality drops as well because, second round infections, if you survive the first one, you do have some level of protection against future ones, obviously. But you do tend to see a bit of a shift then from adults through to children. And that's largely because, the children are still quite immunologically naive. So they're a reservoir for the virus. But ultimately, what we expect to get to, I think, and this happens for coronaviruses, it's largely happened for flu viruses, generally speaking. But you get a sort of an endemic stabilization phase where, infection rates are lower. They still happen. You might see seasonal peaks depending on different variants or waves that are going on. But it becomes sort of a background, and we know this is true for flu, the other coronaviruses that common causes of the common cold, for example. They still circulate in the background. There's peaks and troughs, but largely speaking, we as humans we deal with them relatively well. So I think the big picture, we largely expect this to become another common cold virus, but there's a lot of variables in between, right? How long that can take, how many waves we're going to go through. Do we need to do seasonal vaccination for the next 5 years to manage it? I don't know. What are your thoughts?
Yeah. I think elimination is clearly not going to happen. We are going to have COVID-19, forever. We're going to have to find a way of living with it. Vaccination, clearly very important. I think it's, and after all sort of the discussion over the past year about access to the vaccines, I saw that now 4 billion people worldwide have received at least one dose.
Yeah.
So more than 50% of the world population, which is actually really quite extraordinary in 10 months.
Exactly. When you think of the 10 years it normally takes to make a vaccine and get
Yes.
it out.
Less than 2 years into this pandemic, more than 50% of people will have some immunity, which is quite extraordinary.
Quite disproportionate between the wealthy and the less wealthy countries,
Yes.
unfortunately, but yes. Yeah.
Yes. Though, as was presented from Indonesia, excellent uptake, and that access is now there.
Exactly, and that curve will go up exponentially from here, I think. So, yeah, very good news.
I think that the difficult question is, what is the virus going to look like in a few years' time? So, yes, will it have moderated enough, and will people's immunity have sort of built up enough over the years, maybe from vaccination or from infection, such that it is just another common cold?
Yeah.
Or will we see the virus either itself continuing to change and new variants emerge, which maybe are able to escape immunity, or the virus recombines with, I don't know, it could be the seasonal coronaviruses, it could be MERS-CoV or other
You're trying to paint a nightmare scenario here?
Or the really interesting ideas, though not good ideas, idea is not the right word, but there's concerns that we'll see wild animal reservoirs of COVID-19. And I was reading an interesting report about deer infections and wild deer populations in the US, where COVID-19 has entered the deer population and has spread extremely rapidly. And so what would happen if a deer COVID-19 then is reintroduced back into
Exactly.
We had some cases amongst lions this week in Singapore, and many other animal species have been infected. And that's interesting and, yes, potentially quite scary.
Definitely.
Thought.
There was a very interesting graphic actually around the lion infections this week in Singapore. So Singapore has a daily Facebook graphic that they put out with a number of cases and different populations. And for the first time, it had all the human cases and then 4 lions at the bottom.
Yes,
quite interesting. Dr. Nakorn, how do you see this progressing? Where are we going to be in a year, 2 years, 5 years?
It's difficult to say, but I think the disease will become like the endemic disease. I would see that. Hopefully, the virus itself will not have much more or the kind of stronger variants. My concern is among the countries where has a low coverage of vaccine. That can be a place of big outbreak in that particular place, and then it will generate the new variant. Because we have seen the example from the big outbreak in UK, in Brazil, in South Africa, in India, and then we have a variant of concerns occur from that big outbreak. So I would hope that we should concern on the country where has a lower vaccine coverage and trying to bring it together for the higher coverage of vaccine together with the control measures so that we will not have another big outbreak and then create another variant of concern.
Absolutely.
And the vaccine, I would still have the optimistic, because so far, even we have the variants, the vaccine can be cross protection at some level, especially for the severe cases. So when the pandemic becomes in a kind of lower of mortality rate or case fatality rate, so the disease will not be more frightening because for the moment, if the case fatality rate to be 1 or 2%, that's still high. But if it become to a kind of 0.1 or 0.05 by the vaccination, even we have a number of cases, but we have a very lower of hospitalization and severe cases. So that it will become like that the professor said that it will be another common cold for this world, but it will not be eliminated for sure because the virus itself is easily of spreading, and we still have asymptomatic cases walk and in everywhere. So
yeah, exactly.
we need to live with it, I would say.
Yes, that's
for years. Yeah.
There is some good data emerging, obviously there's quite a percentage of the world's population that have been naturally exposed now. There's quite a bit of data coming out where a single dose of vaccination after, natural exposure provides a really, really good boost to the immune system as well. So I think, we'll probably need to look at evolving our vaccination strategies perhaps, because, there's no point giving 2 or 3 doses to somebody that's already had a natural infection perhaps. So that may be one option for countries that are, struggling to get 2-dose coverage up.
Yeah, and there was a study that was conducted by Prof. Linfa Wang from patients we had recruited at NCID who had SARS in 2003 and then received vaccination with the COVID vaccine, and the immune response was quite extraordinary. So there was a substantial boost to protection that was even greater than people who had had COVID-19 previously and then were vaccinated. Wow, yeah. And the optimistic, more optimistic output from this is that protection seemed to cross all types of coronaviruses. So it was offered much broader protection than we would expect from just a COVID vaccine. And so, yes, as vaccines evolve and develop, we may be able to actually get a vaccine which does protect us against all of these threats.
I think, that's definitely true. I think there's also, there's a more complex aspect to the immune response as well, right? We're all looking at antibody levels and looking at them declining and thinking that correlates to decreased protection. Now, obviously for, mild infection, that's partially true. There is a correlation, but you've got T-cell responses and long-lasting memory responses and things like that. And it's, I think we shouldn't underestimate the value of those in terms of preventing a distant infection later on, and certainly the severe consequences. So we know that, if people can be infected with the original SARS virus, many, many years ago, and still have some level of protection, now.
20 years later.
Yeah, exactly. It's very encouraging.
Yeah, it is.
Dr. Erlina, you started this conversation. Where do you think things are going to go?
Yeah, okay, I believe that everyone, or most of us, including me, we hope that, or we wish that it's going to be just a common cold virus eventually.
Hopefully.
And get vaccinated and live with it, make a peace with the virus. But we have to remember, the mutation is still going on, and there is so limitation of our knowledge with this disease. This is a very new disease. So I think we still need to make some effort for anticipation.
Agreed, yeah.
Yeah. So do not forget with the what can I say? Health protocol, as mentioned by other panelists: wearing masks, wash your hand, social distancing, and vaccination. But we said this is just like a common cold, like influenza. You know that even with influenza, the vaccine is always modified. So be prepared. This pharmaceutical company who produce the vaccine modified your vaccine.
Yeah, that's a very good point. I think there's a lot of companies now looking at next generation vaccines, and for good reasons, obviously. But I think we need to decide yet whether that's really necessary, whether the current vaccines will provide adequate protection. I guess I'm quite encouraged, I think, by the cross protection against different variants that we've seen so far. So fingers crossed, whatever the next mutation will be, because there will be another one. Fingers crossed that the vaccines do provide some level of protection as well. Just final thoughts, Dr. Chiu, and then I want to go quickly to some questions.
I think that coronavirus is different from influenza virus. So even though they have the mutation, but I think because the infected people is so many, so we will meet some mutation. However, I don't think it needs to be vaccinated anyway for a long time, maybe 3 years also. And then if the high-risk people, that including the adult, elder people, and the comorbidity people, they can get the vaccination. And if they get the vaccine, and then next time when they contact with some mutant coronavirus, I think the severity actually won't be so much. The burden will be so much, and so maybe 3 years we can get a happier life.
Hopefully. We'll, at some point, we'll transition back to the new normal, whatever that looks like.
Yes.
Okay, thank you very much. We had a question actually early on when we were talking about the individual country example. So for Singapore, did Singapore also see a correlation of time since vaccination and breakthrough infection? So that sort of waning of immunity. Have you seen anything like that here?
Yes. I'm not aware of data about the severity of infection. I don't have the numbers off the top of my head as well, but there has been an analysis looking at MOH data, so national data, and which has described a waning of protection against PCR confirmed infection.
Okay.
And of course in Singapore primarily people have been vaccinated with one of the mRNA vaccines.
Yeah.
We have a few other which a smaller proportion of the population has received.
Yeah, exactly. And I mean, just to clarify, I guess too, I mean, the data we showed before was around the waiting for mRNA, but this has been seen pretty much for all vaccines so far. So I don't think this is a specific vaccine problem. It's a general vaccine problem, if you like. So something we need to work forward, definitely. That was all the questions I had in the chat. Is there any questions online that people want to ask or in the audience? Okay, this is your last chance. Okay, so what I would like to do is a big warm thank you to all my great panelists. Very engaging discussions today, very complex issues I think that we're dealing with in a very uncertain future, but great to hear your thoughts, and thank you very, very much for your contributions.
Well, thank you for the opportunity to talk here.
You're welcome. Thank you for the audience, those here in person, and I know there's many, many more online dialed in for this virtual conference. So thank you for your participation today, and enjoy your day.